I've been working on a program where I've spent a lot of my own money.
Talk about it. I'd love to hear about it.
I'll give you the 2-second version. The reason that Obamacare does not work is because it's based on insurance. There is no healthcare program ever that will succeed based on insurance, because insurance has nothing to do with healthcare. It's a financial instrument.
You're correct.
But I'm also a believer that there are 47 million people that are eligible for Obamacare, the ACA. There are a bunch covered by Medicare, a bunch covered by Medicaid, and so they cover the external sides, but across the middle, there's the 47 million that are eligible for Obamacare. And what I did was I sat down with all 14 of the people that helped create Obamacare. And I presented them my idea, and I said, what are all the things we need to do to make sure that these 47 million people are covered? I took all their ideas. Then I sat down with a bunch of people from the far right, if you will, that are libertarian and laissez-faire driven. And I said, okay, we need to cover these people. What do you think? So I took all that in. And then I did what I should have done right off the bat. I looked at my own companies. I self-insure. And then I looked at all the big companies across the country. 95% of companies with 5,000 or more employees self-insure. And they self-insure, meaning they might use insurance little bits and pieces, but for the most part, they take on the risk themselves, because it's only the financial risk that they're really absorbing. So I put together a program, and I sent it to the most far-left economist that I could find, a company called Sonicom. And I said, here are the parameters. And the parameters are, for the average family, the individual making $50,000 or less, and a family making $84,000 or less, I want to see if we can do an 8% on-demand solution. And what that means is, if you're not sick, you can do nothing. So you guys mostly on your parents' healthcare plans, but let's just say you're not, and you're 27 years old, and you need to determine what you want to do. Now, if you want to buy insurance, you can. That's your option. It's a financial choice. But I put together this program that said, all right, if you need health care, you go and get it. If you can't afford to pay for it, then the government will guarantee your payment, but you will get dinged for up to 8% of your income that'll be automatically deducted from your paycheck. And that's the most you will pay. Now that 8% turns out to be less than you would have paid in insurance, but because you took out the insurance companies, because you took out all the administrative costs, because you took out the way everything is siloed, when I sent it to the economists and they scored it like OBM would score it, OMB rather, I'm getting all backwards today, OMB would score it, you know what they came back with? Consumers would save $45 billion per year. The government would save $40 billion per year. And I'm like, okay, this works. But the challenge has been taking it up the tent pole, right? And so working my way up and getting it into the administration. So let me just say it again so everybody understands, because I'm sure people will ask, or media or whoever will come back and ask me. No insurance, completely out of the mix. If you're healthy, if you want to get preventive maintenance, that's up to you. When you feel you need to go to the doctor, and it'll cover things that are covered by Medicare to start, and then we can add to that for other things that we don't need to go into here. But the most that you will pay is up to 8% of your paycheck, and you'll pay up to that 8% until the amount's paid off. So if you need a hip transplant and it's $15,000 and you pay your $100 copay, the rest is deducted. If you make $30,000 a year, 8% of your net salary is being paid to pay this back. Once it's paid off, it's paid off. If after 15 years it's not paid off, it's written off. After all that, you get to control who you buy your health care from, how much you pay because you can shop, and where you get it. It's completely up to you. That works. Now the hard part isn't getting people to believe it works, because I've shown it to senators and Republicans to get it done.
Well, but I think you're onto something with the insurance companies. I come about it a little bit different. I think the problem's in healthcare cost and healthcare delivery, not the health insurance. Let me finish it really, one quick example. So you know LASIK eye surgery.
Sure.
It's not covered by insurance
Right.
because it's considered
The
a
price is a lot lower, yeah.
Right. So LASIK eye surgery used to be $20,000 per eye.
Which is, you're exactly right, which is in this program, right? Right now, you have networks that you have to work in because those networks are defined by the insurance companies. So with the 8% on demand, you can go to any doctor.
But what's going to prevent the healthcare deliverer from jacking up the price of healthcare if the government's negotiating with them?
No, the government's not. The government's, you're using the Medicare price points as a starting point.
But those price points are overly inflated, full of waste, fraud,
Well,
abuse, and
that's fine.
horrific delivery.
So if I go in, that's up to me. So put aside LASIK, but if I go in because I broke my ankle, right? One hospital is $2,500, another hospital is $1,500.
That's not the way it works. They don't quote it.
No, that's in this program.
So there's a price system.
Yeah, there's a whole price.
Okay.
There's a reference price list.
I support a price system.
Yeah,
in
there's a
healthcare.
price.
I agree. A price system. It's good.
So there's a price, but you can also negotiate past it.
So good.
So if the price, if the reference price list is $1,500 for your broken ankle, and you go in and you say, "Look, I'll do it for $1,200. If not, this other guy's going to do it for $1,100."
Yes, that's exactly right.
That's the way my healthcare program.
So just so everyone knows, the way healthcare works, you walk in, you say, I have a broken knee, and you ask them what it costs. They'll laugh at
tell
you.
you, yeah.
They cover their prices, and so I think
Well,
transparency.
that's because most of it's driven through insurance companies.
Of course, because they don't want you to know
Now,
because of the reimbursement.
if you're a cash pay, you can negotiate. But with this program, you have the option. So there may be, let's say you have a heart problem, there may be a super cardiologist that's a lot more expensive, and the amount that we'll guarantee is limited, and you can't afford that person. You have the option to pay more yourself. So if you want to go to the best, if you like that doctor, you can use that doctor.
If you like your doctor, you can keep your doctor.
Well, you can find
Mark
a new
Cuban
doctor.
said it himself.
I said you can find the best doctor. If you want the best doctor, you can go get the best doctor. If you have to go to the emergency room right now, it's horrible because if your doctor is not, if the emergency attending physician is not in your network, it's going to cost you a fortune.
I actually agree with a lot of what you're saying. Some of the details we could talk about at length later on. But what I love is that it's a business-minded solution, market-based type
Well,
reform.
what you'll love even more, I've spent a whole lot of money getting it studied and getting it scored. And so this isn't me just saying, hey, this is a good idea. This is me spending a lot of money, bringing in a lot of people to say, okay, poke holes in it. Tell me why it won't work. Put it together in a way that will make Republicans, because it's full repeal and replace, happy, and Democrats happy because it immediately covers 47 million people. Every single person who's eligible for Obamacare can use the system day one, and you can get the health care you need and want, and you get it far less expensively than having to pay into an insurance-based system.
One of the things we talk a lot about is the power of markets, and you know this. And capitalism can be described in the 3 Ps: prices, profit, and private property. And the problem, as you just pointed out, in healthcare, there's no price system. So people because the insurance companies intentionally muddy it up.
Right.
And the insurance companies have become pseudo-monopolies in these states. So one thing I would ask you, would you support allowing health insurance to be brought across state lines like auto insurance and home insurance and flood insurance? Because that's a market.
Yeah, but that's shuffling deck chairs on the Titanic. It's, because it's still, for healthcare.
It worked in auto insurance.
Yeah, but for healthcare, it's different, right? Because people.
So tell me, okay.
Because if you're sick, you're not worried about getting the best price. You want the best care, right? And you're not. And so the difference is with my program, you can go to any hospital, any doctor, right? And if they support the reference price list, you just go. You walk in immediately. You show your driver's license. They scan your driver's license. Then you get an okay from your employer to say we'll deduct the amount, and you're good to go.
Right, but I guess the problem is that most healthcare is not emergency, not life or death healthcare. Most healthcare is broken ankles.
No, I get that, right? But the markets are there, so you want markets, right? But you're suggesting you use insurance to go across.
That's a mechanism. That's a component of it.
Insurance. Once you base anything on insurance for healthcare, it's guaranteed to fail.
You need some form of insurance. It's a risk.
No, that's the whole point. You do not need some form of insurance at all.
So then why would an employer provide health insurance at all under your program? They wouldn't?
Well, it's up to them, but it's a value add. It's a perk.
Right.
That's why they provided it in the first place. When there were wage and price controls, they introduced health insurance as a perk.
Right, but alternatively, your plan would be to try to get people on this broader government-run risk pool.
If my companies, I would still continue to provide health care.
Right, so do we. I mean, Turning Point provides health care. We have to under the Obamacare mandate, but that's...
But that would change. That would change. You'd have the option.
Oh, that's interesting. Okay, so now we're getting somewhere. So get rid of forcing employers.
Again, I can't say it. I told this to President Obama. Any system built on healthcare, any healthcare system built on insurance will fail.
I don't disagree.